Thank you so much for joining us. We are doing something new and exciting with this season of No Longer Silent. This time, we are going to insert voices of other national leaders to help expand the conversation. We hope you enjoy this new feature and let us know what you think in the comments.
Damage from the deep cuts to Medicaid in President Trump's spending bill could extend far beyond rural hospitals.
This is just one in a series of many, many cuts we're seeing across health agencies across the country.
Billions of dollars are on hold nationwide.
A local nonprofit organization says recent cuts under President Trump's new spending bill will force them to cancel one of their programs.
Federal officials are cutting more than $11 billion from health organizations across the nation.
No Longer Silent. Advocacy Leaders Unmuted. Hello and welcome to season 2 of our No Longer Silent podcast. This is an advocacy leader learning series that we will get to hear from the nation's top leaders who are making a difference in fighting and advocating on behalf of each of you. We are so excited to kick off this season with Miss Sandra Poole. Sandra Poole has been a longtime friend and advocate. This episode is called Silence Won't Save Us. Health advocacy is literally a matter of life and death. Welcome, Sandra.
Thank you. Thank you, Reverend Tammie. It's my pleasure to be here.
Oh, we are so happy to have you here. It's a joy to get this opportunity to have a conversation with you. I get to see you in the halls of the Capitol here. I get to see you in the community, and you and your work are highly regarded. And I know for one myself, I am greatly appreciative for you always being a staple, as long as I can remember here in Sacramento, advocating on behalf of the least of these and the rights of those who are often overlooked. Why don't you tell us a little bit about your work?
Well, thank you for those kind words, and back at you, because I just admire the work that you do in the community. I have always been a social justice junkie, I will say, and advocacy is just part of who I am. I have worked in policy from county government, state government, and nonprofit, but currently I am working with Western Center on Law and Poverty as a health policy advocate. I'm a registered lobbyist, and what we do is we advocate for increasing access to health care for those that are low income and racially marginalized communities. And over the last couple of years, my work has been focused on increasing access to maternal care because of all the disparities in that area. So again, I'm just so happy to come and talk to you this morning about this very critical issue.
Thank you. And I would be remiss, and your sorors would eat me alive if I did not acknowledge that you are also a member of
Alpha Kappa Alpha Sorority Incorporated. It'll be 39 years this year.
Oh, wow. Wonderful. Congratulations. That's a huge milestone. And you're active in your sorority as well. So your reach is broad and wide. So thank you. So let's jump right into it. This episode is entitled Silence Won't Save Us. When Carrie's Touch first began almost 20 years ago, our mission statement was to break the silence that adversely impacts African American women diagnosed with breast cancer. But I think we could say that around the same thing with the work that you are currently doing with regard to infant mortality. We know that it is well documented that Black women face specific disparities in healthcare, right? In areas like maternal health, pain management, chronic disease diagnosis, and medical bias. What steps should Black women take to advocate for their health and to advocate on behalf of their families?
That's a very important issue. You know, you've heard that old adage that when white America gets a cold, Black America catches pneumonia. And because the disparities experienced by our communities are so devastating, effective advocacy is truly a matter of life and death. So I really appreciate your topic for this morning. I think one of the main things to do up front is to educate yourself and to know your power. we need to look at trusted resources to educate ourselves about our health conditions, whether we're going to sources like the Black Women's Health Imperative, the Mayo Clinic. We used to be able to trust the CDC. Now I'm not sure that I would feel comfortable recommending people rely upon that data. But one thing I will say is you can't rely on social media. I find so many times that folks are going to social media and there's a lot of conspiracy information, but just look at trusted resources. The other thing I would say is know what your rights are, that you are entitled to second opinions, you're entitled to access your medical records. And to the extent possible, you're entitled to culturally competent care. And it's also important to know your family history. So I often tell folks when you're getting ready to go to your appointments, write down your concerns, your questions, your symptoms, because often we go to the doctor's office, it's just a blank. You just forget all about that. And some folks aren't comfortable doing that or speaking up for themselves at the doctor's office. And there's no problem with taking somebody with you, whether it's a family, friend, or an advocate. Research the providers that are assigned to you. Go on the internet, see if they look like you. You might want to get somebody else as your provider if there's been complaints about that particular provider. But do your research and your homework. Just trust your lived experience and trust your body. You know your body more than anyone else. So if something is not feeling right, or then don't be afraid to speak up. And that also means if your provider is dismissing you or not listening to you, then you need to say, I'm not comfortable speaking with you at this point, and I think I want to talk to somebody else about this. And I'll just leave it there. There's a lot more, but I'll just leave it there. I could do a whole thing just on advocacy.
No, we can stay there and we can go there because I wrote a lot of notes and I have a lot of responses as well. Carrie's Touch has an app. It is geared toward Black women with breast cancer, but this app is something that anyone can use. And on this app, there's a section called Before You Go. It's a self-assessment that you take for yourself, and it allows you to take notes in the app, and it asks you questions like, what is your understanding of the purpose of this visit? Because a lot of times when you go to a lot of doctors, you don't know what doctor you've gone to, what's the purpose of the visit. It asks right now, what are the top 3 things that you want the medical team to know? What are your top 3 questions you want to ask your doctor? Because when we're having the experiences are the adverse side effects to medication or just not feeling well or whatever. It's prominent in the moment. But when we get in that doctor's office, it's a very different experience because white coat syndrome is real, and especially among our people, right? And so we get in the doctor's office and we clam up, and all of a sudden we don't have any of the symptoms that we had just days before that were so prominent. We knew we would remember. Our Carrie's Touch app and the Before You Go feature within this app can help patients stay organized. So that's a tool that you have in your back pocket. I encourage you to download it, test it out yourself today, and use that as you continue to do the amazing advocacy work that you do.
That's absolutely needed. And I just hope that more folks will become aware of that.
Yeah.
The only other thing I would add is to be proactive about seeking care and not wait until it's a crisis.
Yes, yes. And you and I, we're in this work, we see this work, we do this work on a daily basis, right? And so sometimes I feel like we can be immune to the severity around how difficult it is to choose self, especially as a Black woman, and especially because of our history of not being able or given permission to choose ourselves and to prioritize our care and our well-being. And as a result, that creates trust barriers between medical professionals and us and or our caregivers. So I love that you talked about trust, but you talked about it from the perspective of trusting yourself, trusting your body, and trusting your lived experiences.
Yes, yes.
I mean, how powerful is that to take trust and flip it, right? Because we talk about all the lack and the lack and the lack. And you framed it so beautifully in such a positive way that I think that, yeah, I'll give you credit. I will say, Sandra Poole shared this with me, and it just stuck with me because I love the way you frame that, because it's very, very empowering. And I think that as we continue to have these types of conversations,
Absolutely.
we get to open the door to remind women to celebrate you. It's your birthday, and you said be proactive. And so, what better way to be proactive than to center and focus on you and your health and well being? We want to pause for a moment to thank our platinum partner, Amgen. Amgen has been a consistent partner who not just talks the talk, they fight hard to illuminate voices and experiences of diverse patients. We're truly thankful for such a beautiful partnership. Who's left out of the current policy process, and how are we actively working to change that?
Just even speaking of lived experience, those are the groups that are commonly overlooked by policymakers, and that's people with the lived experience of the issue. When I worked in state government, we had this saying about making policy in the ivory tower. Policymakers think they know best and they know better. And so they develop a policy and then try to make those that is supposed to impact fit. And it just doesn't always work. One category of folks that are often excluded, also just traditionally marginalized, Black, Indigenous, other people of color, LGBTQ, now immigrants and refugees, disabled people, all of those are often overlooked. You also have low income communities. Because of economic barriers, they're just not able to participate. They're not able to take off work without pay or not have their transportation or childcare reimbursed. There's other groups. There's the non-English speakers. There's rural communities. But there's things that we need to do to change that. And one is to proactively reach out and build trust. Don't wait for people to come to you. We need to reach out. We need to compensate people. We need to provide childcare. We need to provide transportation, stipends for their time. And then we also need to make sure we use inclusive language and communication with these groups so they feel comfortable being included and participating.
In one regard, it's enlightening, and in one regard, it's sad, because it's the same song that we've been singing for decades.
Absolutely.
Right?
Absolutely.
We have been fighting for these rights for decades. The only difference today, and potentially 10 years, 20, 50, 60 years ago, is that the diversity pool has widened.
Mm-hmm.
However, we do acknowledge that, when you look at diversity, equity, and inclusion, it typically falls on the shoulders of Black people.
Yes.
But that community, including white women, who are now finding out that, oh, you're not different than the rest, but what practices can we ensure that we're not just including patient voices, but we're also redistributing the power? You talked about empowering people and reaching out and to remove these barriers, but how do we do that?
How we do that is we invite people in to co-design, not just for consultation. Patients should help to set the agenda, to define the goals, to shape the process. And then we need to value their lived experience as strategic expertise. We just don't need to keep bringing people in for their personal anecdotes. There's experience and expertise there that we need to value. This is kind of a motto in state government where the legislature will establish some new program, tell the department they have to implement it, and that they should get stakeholder feedback. And there's one particular program I sit in sometime on their implementation group meetings. I'm not going to mention it, but they invite folks to come in who are CEOs of nonprofit organizations, probably operating on a shoestring budget, having to do the work themselves. They don't have a bunch of assistants that are helping them to do this. So you're asking them to take away from that work, to sit in these meetings, review documents, and to provide their expertise and their input, but you won't even provide a stipend
Right.
for their time or transportation costs. And you'll hear the constant mantra is, well, we don't have money for that.
Mhm.
But they have money for multi-million-dollar contracts for facilitators to facilitate those groups. So that whole model needs to be shaken up in order for, if we really want to hear voices, make it accessible for them to be heard.
Say it again for the people in the back. Woo,
I say that a lot. I really get frustrated,
yes,
because they're
mm,
using our expertise, they're
there-
using
yes,
our community-driven
yes,
practices to
yes.
establish these programs and won't compensate, and that's just unacceptable.
And we get stuck on, having a seat at the table, that we lose sight of the assignment, of our God-given assignment, first and foremost, and
Right.
or the reason that we were sent there by our jobs. When you are doing justice work, you're not there to just get along, which brings me to where we are in this administration, right? If you do anything that is against this administration, we have seen it at the highest levels, right?
Yes.
You are
Yes.
in jeopardy of losing your livelihood, yet we have a criminal
Yes. Absolutely.
in the White House
Yeah.
who is robbing and raping America
Yes.
as we
Yes.
speak. When you say that we need to compensate people and give people these stipends, but budgets have been cut
Mhm.
across America, what impact would you say that the Trump administration's budget cuts
Hmm.
is having on Black communities and women? And what can we do to advocate for ourselves at this time?
In the work that I'm in, it's almost depressing because every day is something new with this administration.
Mhm.
We are probably aware of the budget cutbacks and the impacts it's had on and will have on Black communities, women, and our families. Just the fact that they've reduced Medicaid spending by $1 trillion, or will over $1 trillion over the next 10 years. And this is going to be accomplished by implementing these new requirements that's going to make people ineligible for care. In California alone, it's estimated that these federal changes are going to cost our state $28.4 billion and result in 3.4 million Californians losing their coverage. California made great strides under Obamacare, and I'm proud to say Obamacare, or the ACA, the Affordable Care Act, in increasing both access and quality health care in the state. And as a result, currently we have one of the lowest uninsured rates for medical coverage in the nation. All of that stands to be just upended. Some of the other areas that the Trump administration is really impacting our communities is because there are so many disparities in our community. There were a lot of federal research grants given to do some work to try to focus on those health disparities. Well, those are being canceled. Almost every day, there is something different that he's doing to attack us through his policies.
Let's bring another voice into this conversation. How are your organizations navigating this new space with funding?
Well, I think it's a problem that ultimately impacts the patients we're all trying to help. We talk about the fragmented healthcare system, and we really don't have a system. We have a sick care system. The other part of that system, programs like SNAP, Medicaid, or housing support, is the safety net system, which is just as fragmented as the healthcare system itself. What we're seeing is that safety net ecosystem being unraveled. It used to take our case managers on average about 20 contacts per case and about 10 days to solve just a basic resource need issue. It's now 40 contacts per case and takes almost 3 to 4 weeks to find something as it relates to basic needs like food, housing, transportation.
Thanks, Alan. Be sure to come back and check out Alan's full episode.
So your question might be, what do we do about it?
That is the question.
One is get informed. to know what's at stake, what programs are being cut, but also what are some of the rules behind that. And then build a local advocacy team. You'd be surprised that even though these things are happening, there are things that we could do if we're vocal and we're out there and we're contacting our legislators in Congress and telling them why this is going to impact us and why we don't like this, and reminding them that there is midterm elections coming up. We need to engage them. We need to use the power of our stories in the media, make sure that our stories are being told through the press, through social media. The other thing is we need to take care of each other. Advocacy can be just emotionally and mentally exhausting. But we need to build in moments for reflection and rest, celebrating wins, even the small wins. But those are things we need to do, and we need to honor community voices and leadership during these trying times.
Man, I am pushing back on we have to do this, the things that we've done in the past.
Mhm.
Yes. And what are the new strategies, right? Because we are playing with a whole different set of rules. And even though people are saying we've been here before, well, kinda.
People, I think you got it. People used to play by the rules,
Yeah. Yeah.
and that's all been thrown out the window.
But when we're talking about moving this political needle,
Yeah.
we've got to come up with some new strategies.
People are afraid to talk.
Yes.
There's a few things that we really need to do, and one is to build support before you speak out. So that there's an issue, you're going to be speaking out. If you can gather up your allies, it does increase safety and impact that feeling of safety to have that group with you. It's also good to use stories and data. I often sit in hearings. Folks will come and testify before the legislature, and they have all this data, and you can see them almost going to sleep. Their eyes are glazing over. Right. But somebody comes in with a powerful personal story, and you see them wake up. And so I think as a strategy, we need to use both. We need to get the stories out there as well as the data. And we need to speak to both the hearts and the minds of people. Start where you feel comfortable, where you feel you have the power, and where your voice has the most reach, and use that as a jumping point. Ground yourself in your purpose, not in a performance, but in your purpose for getting things done.
That's beautiful. Thank you. That is so helpful, because it gets hard out here. Advocacy is not our first arm, but it's a necessary arm. If, ultimately, when all's said and done, if we can say that Carrie's Touch has done anything and done anything well, it would be moved policy forward in an effort to be able to lower the number of Black women who continue to die at 41% higher rates than white women diagnosed with this disease, even though we have similar diagnosis rates.
Right.
And so for over 20 years, that statistic has not moved. And so no matter what we do, until we move that needle, our work continues. Thank you. Thank you. Thank you for this powerful time that we've had together. Secondly, is there anything that I didn't ask, but you want to make sure is heard in this segment?
I think the only thing I would say is that we really need to think about getting out of the traditional molds of our input and how our voice is being heard. We often see that grants, they're going to their trusted organizations who may give our African American nonprofit organizations a few crumbs to be able to say, oh, we have, this group working with us or whatever. We just need to start taking back our power.
Yeah.
And getting our message out there and being proactive. We can't be complacent. That time is over, and we need to look to our ancestors and what they had to do.
Yes.
And use that as a model for moving forward.
I just have a couple more questions. These are the hardest ones. We save the hardest questions for the last part of this. So get your brain ready.
Okay.
Number one, does sugar go on grits?
It depends. It depends. I've had both.
I'll forgive you. The
I'm
correct
trying-
answer, people,
when
is
I'm in my
no.
lose weight mode, it's no sugar.
Yeah. It, listen, people, it's never sugar on grits, okay? We love Sandra, but yeah, it's never sugar on grits.
Okay, butter and salt it is.
Butter and salt and pepper. It's savory, not sweet. What food would you kill somebody for?
I love seafood.
Mm.
I love seafood.
What's your guilty pleasure?
Cooking for my family. I do soul food Sundays. It's just something about showing my love that way. I don't know. It's just a joy just having them there. And I think the other things for my guilty pleasure is because we're so into that we're not even supposed to take time to relax. And every minute's supposed to be filled up with something. And I'm learning as I get older that every minute doesn't have to be filled up, doing something.
What makes you smile?
I think I just love to laugh. And I have some friends that are just out and out funny. And we'll just laugh until we're in tears over the silliest stuff. So that makes me smile.
I just am delighted to have had just a little bit of time to experience the greatness and the depths of your love today.
Yeah. Well, thank you. And I just want to say that July is traditionally a hard month for me because I lost my mom to breast cancer 5 years ago this year. But I remember thinking of you, and I don't know if you remember, I reached out to you when she was diagnosed, and you said, do you want me to send her flowers? And that just meant the world to me. So I just want to say thank you for all the work that Carrie's Touch does. And if there's any way I can support you, just let me know.
Oh, wow. Wow. I'm glad that we were able to do something to bring a little bit of joy to you and your mom in her season. Yeah. Wow, Sandra, this has been such a rich and enlightening episode and discussion. Thank you for those nuggets that I will hold dear to my heart. Keep doing the work that you're doing. Keep being a disruptor. Keep making a change for good. Thank you so much, Sandra. Thank you so much for listening to No Longer Silent Season 2, Advocacy Leaders Unmuted. Special thank you to our platinum sponsor, Amgen. Thank you for being such a long-time partner and friend in this advocacy space. And none of this would be made possible without our dynamic tribe here at Carrie's Touch. Thank you, Josh. Thank you, Angelica. We will see you next time on the next episode of No Longer Silent.